I believe you are next on the agenda. I will take this moment to apologize to all of you who have had to wait. It was not something that was on our agenda until late last week. It's something that we needed to take time to do. We appreciate the auditor coming and spending her time with us. I apologize for all that had delays at that time.
Well, for me, you don't owe me an apology. I appreciate you letting me be here.
Right.
So,
Very great.
good evening. I'm Ginger Cousins, and I'm the new executive director at the Scotland Community Health Clinic. I came to work in August of this year, and on my first day there, I made the comment that I said, I smell mildew. One of my little girls said, "Oh, we have a hole in the roof." Welcome to the clinic, Ginger. and so I said, "Well, how long have we had this hole?" And they said, "A year and a half." And I said, "Did anyone consider having anyone come look at it?" I don't think so. So we are working with a roof with a hole in it, but have been very graciously aided in that. Garland Pierce, I asked for help from the state. I asked him for there was state funding that could help us, and he immediately got to work. We had worked on a couple of things together, and he got me help within 3 days. Within 5 days, I had emails in my computer from the corporate Lowe's in Charlotte, and they gave us $8,000 in material vouchers. So I've learned if you ask, sometimes you receive, especially when you're trying to do God's work. But the clinic, I just want to tell you a few things that I've learned since I've been there. Number one, I didn't know where the clinic was. I've been here 40 years and have been in business the whole time I've here. I've worked this county since 1973, and I never knew about the free clinic. And they called and said, "I've got a job you'd love." They were right. I love it. I think I was meant to be there. I really do love it. But I want to tell you some things about us in case you don't know about us. The clinic was opened in July of 2007, and we provide medical care and medical prescriptions at no cost to the uninsured adults 18 to 64. Now, a lot of people have the feeling that our people are poverty, and that's just not true. It's just not true. The ideas about what people think about clinics sometimes just aren't real. A lot of my people, especially the new patients that are coming in, I personally have handed out 250 brochures. I go to the grocery store, I take a handful of brochures. I go to the drugstore, I take a handful of brochures. And from those new patients, I would tell you that a huge percentage of those people work. They're working middle class people, and they still cannot afford the insurance. And so we're trying to help those people. And if they could pay for the insurance, they can't buy the medicine because the cost of medicine has skyrocketed, as you know, if you have to buy it. But I am just, it's really sad to see young people, especially your young people and your middle-aged people, working so hard to try and have jobs and work, and still they can't buy medicine. So we really are helping a lot of those people to make their lives a little bit easier. Many of our medicines are provided by Medicist. I don't know if you've ever heard of it, but it's a huge corporation, and they provide probably 90% of our medicines, which is truly a blessing because we just order, they send it, and we buy things, but usually it's like flu vaccines. Flu vaccines this year were $2,000. I got that bill the next week after I got there. And I said, "What is this for?" And they said, "Flu vaccine. It's in the refrigerator." But I said, "Listen, I've already been to Walgreens. They will do our flu vaccines free. All we have to do is provide 25 people. If we get 25 people, they pay for the vaccine, and the shot's free." So next year, guess what? Not going to spend $2,000 on vaccine when we can get the patients in and get it free for them and free for us too. But one of the things that I love about the clinic, we don't do narcotics. We don't do narcotic drugs, and I think that's wonderful. It's a safety feature for us, the people that work there, because you don't worry about somebody breaking in and killing you to get the drugs. But we have right now about 150 active patients. And most of those people are diabetics, hypertension, high cholesterol, COPD, and obesity. On the other hand, with COVID, we're seeing a lot of people coming in that have symptoms that they might be candidates for COVID. And we have added, we had, as of last year, they had closed the clinic down to one day with one doctor that probably worked 12 hours a week. You can't run a business and not have anybody there to help anyone. You have to have people to run a business. And if you're going to have a clinic, you're going to have doctors, and you're going to have labs, and you're going to have all the things that you need. So when a person comes and is sick, you don't have to say, we can make you an appointment 2 weeks from tomorrow. Well, guess what? If they're sick, that's not going to work. That's just not going to work. So I think we've done the right thing by adding, we have 4 doctors now. Doctors don't work cheap, but they are very, very good. We have 2 that have just finished medical school, and they are just dynamite. We're just really excited to have them. One works free. We have one doctor who works free. And she touches my heart because I know her heart's in the right place. But COVID, we don't give the shots nor do the testing for COVID, but we do have programs that we do for COVID patients. The doctors that we have, the COVID, one thing that I really like the sound of is this vitamin D program. I know you've probably heard about that. It's vitamin D2, and it's excellent to help prevent you from getting the symptoms of COVID. And so when you come in for your first lab, first thing they do is check you for vitamin D. If you're low, that she puts you on 50,000 milligrams for 90 days. And then every 90 days they test you. So they feel sure that it's helped some of the people to keep them from getting so weak that the COVID hops on them. So I think that's a great thing. But we also have, we do a lot of things for the COVID patients, but we give masks, we give the hand sanitizers, we do nebulizers, we do the things that you breathe with. What is it that I'm trying to, inhalers, all of that we give to them. And then we also treat the patients who have had COVID. And that is a huge thing. I don't know if you hear about that a lot, but the virus is leaving people so devastated and their body's just ravaged. So a lot of them can't breathe. A lot of them have problems with all kinds of things directly related. So we do handle those patients and handle them, I think, very well. We do a really good job with them. With our diabetics, we furnish insulin. Have you checked the price of insulin lately? I'll tell you, it's unbelievable what it costs a person that's diabetic to buy insulin. And you have to have it. It's something you have to have. But we do insulin and all the test strips, and we have referral programs. Like if you come in and you have something that you need additional help that we can't do, we have a program with UNC Chapel Hill. And we refer you to them for serious matters, and they treat you and they don't charge you. So I think that's a wonderful program to have. We give mammograms, we give pap smears, we have birth control clinics. We work with North Carolina Prevent Blindness company, and they are furnishing us with vouchers for people that are diabetic or have severe eye problems. They're furnishing glasses. So now we've passed that on to Dr. Bolin, and he's reaping that little reward, but he's been very gracious to help us and to do things that we needed done. We have, at the present time, we have 4 doctors. Like I said, we have a pharmacist who's a pharmacy advocate. We have a prescription assistant. We have a medical records assistant. We have an office manager, and we have a triage lab assistant. Now, you say, that sounds like a lot of people to me. That's where you're spending all your money. No, None of these people work hardly over 20 hours a week. And some of them, 3 of them have been with us over 10 years. And that shows you the dedication and how much they love what they do. Our budget is $240,000 a year. I can tell you that when I came, they told me I had enough budget to last till next June. I didn't write a check until October, and the budget didn't last till the 1st of October. So somebody wasn't truthful with me about that. But that's okay, because we got out and we got busy and we asked for help, and we did have received it. But living week to week in a clinic is not fun as a director, because you stand on that edge of, can I meet payroll? Can I pay the bills for the clinic? And we need help. I'm being very honest. I went back through the records, and in 2015, the churches in this community gave $100,000 to that clinic. I get 2 checks now from 2 churches. One's for $82 and one's for $100. Every month they send their checks, and they're the only 2 in this whole county that give. And that is startling to me. When you're helping God's people, why won't God's churches help you support it? I just don't understand. But the thing that I'm asking you to consider, I would love for you to consider helping me get a cushion for this clinic, so that every day I don't have to worry I buy a pack of pens if I can meet payroll. If you will help me with that and let me get that foundation, I will leave that clinic sitting over there and let the girls can run the part of it. They don't do the part that I do because no one ever trained them. But I will get out in this community. I will go to the businesses. I will go to the churches. I will introduce myself, and I will ask for help, because I think that it's very honorable thing to do. I find a lot of peace in it. And my husband said, after all these years of working, I've worked since I was 10 years old, I come home happy because I see people every day that it helps. And that's what it's about, helping other people. And we got letter after letter of people, thank you for helping save my life, because they couldn't afford the medicine. One particular little lady, house burned, she lost her car, she lost her job. She was on diet, she was diabetic, she couldn't get medicine. Someone brought her to the clinic. And do you know that she doesn't have a lot of money, but every month she sends me a check. Every month she sends that $10 check and tells you how much she loves you and appreciates you, but she wants you to use it to help somebody else like you helped her. Now, if we could get a lot of people doing that, we wouldn't have to do grants. A lot of people have said, y'all did so good with grants. What happened? Well, the secret to a grant is you've got to have money in the bank to write the check to send it in for the grant money. And if you don't have money in the bank, you better not be writing the check. So it gets to be a double-edged sword. But I know you're tired and I'm not going to keep you, but I am asking if you would consider $150,000 to get us going from now till June, the end of June of 2022. That's our physical year. And then if that goes well and you're pleased with the results we're getting, if you would consider helping us the next year, if we do well and you're proud of the way we've handled your funds, I promise you, as long as I'm there, they'll be handled the way you want them handled. But I am asking you for your help to help us grow our practice and to continue helping these wonderful people of Scotland County. Thank you.
Because you said one year the churches gave $100,000.
2015, $100,000. And and I'll tell you, because I don't think they would mind me telling you, the churches that give are Trinity Presbyterian and First Baptist. Every month I get that, they get those checks like clockwork. And we have 2 other individual, well, 3 counting the little lady that sends us $10 check. 3 other people send checks religiously, just like they pay their light bill, they send us a check. And it isn't always people that you would think. You know, it's not always the guy that has all the money. The thing that really I want to reiterate too, we're a free clinic, a charity. Every penny you give is a tax write-off. So I don't understand, you know, I think that I can go to the companies with it and say that to them. You know, don't pay taxes when you can give it to us and let us help people with it and still get a tax write-off for it. Why wouldn't you do that? I think they would. I think they just need to know that we're there and what we're doing and that we're sincere with it. And I would appreciate your help, even in consideration. And thank you for letting me be here.
One quick
Anybody else
question.
have questions?
Do you get funding from United Way?
Yes, I do.
That's
As
all
a matter
we-
of fact, I got a check for $2,000 this week.
Okay.
And what a blessing it is.
Yeah, okay.
And I know many of you probably know Emerson Vaylor. Do you know Emerson? He
Mhm.
has been so instrumental working with United Way and Red Cross.
Huh.
And I think he sees the need. He ran into me a couple of times, so I probably poured out my heart to him, told him how broke we were. And he has been over and he has been instrumental in just trying to help. Just let me come and redo your system for you. It's antiquated. You need something simple and easy and fast. I mean, just all these things. People really that sincerely try to help you stand out in your mind. They really stand out in your mind. But everything is appreciated. And again, thank you. Anyone else have questions?
Do you have, does anybody, did this agency exist with grants earlier? Did they get grant money earlier? And who wrote the grants and is that person still there?
No. But now, I have seen the grants. I mean, I think I can write a grant. I mean, it's not, the only thing about the grants, they are so detailed and you get one from a particular company and you can only do this with it. And you can only do this with it. You know, you're so limited. We need something that will say, you know, this is for your operations. What you need to operate that clinic is what we need it for. Some of you don't know me real well. Some of you know me real well. I'm not going to go out and give everybody raises. You don't have to worry about that. I was there 2.5 months before I let them buy toilet tissue. We had toilet tissue and we were going to use what we had because I knew that the money just wasn't there. So you don't have to worry about me throwing away the money. The only thing I want is a cushion so that my hair will stop turning gray and that I can get out and work and not be worried about being there trying to make it send somebody home. And see, what I'm finding is I'll work and let them go home. You know, you're trying to save everywhere you can, but yet my heart wants to grow that clinic and you're not going to grow it that way.
Thank you.
You're welcome.
Is that something some of that federal COVID money would qualify for?
Yes, sir. Because this is specifically public health, and it can, public health that can go into, with COVID treatments as well as general.
But I mean, it wouldn't have strings that she would have to.
They would be tied back into her general operations. And with reporting back in, and also we would wind up tracking at least, not necessarily treatments, but we would track some of the addresses of participants. And you'd probably find that a number of them are also going to be in qualified census tracts as well. So this would be a very strong ARF funds.
And how much do we have left of that unassigned? The first installment anyway.
Right off, we've
got enough for that.
yeah.
How much is enough? Give me just a round. I'm not going to hold you to it.
Yeah, so we started with 3.4.
Right.
And we have allocated, I would say maybe 200,000 or 300,000 of that so far.
And
That's
that's,
actually direct. Those are actual where we've allocated
Spend it.
expenditure.
I know the last we said we got about 2 million if I'm
Yes.
right.
So
I make the motion. We use $150,000 to Scotland Free Clinic of the COVID federal money for this year and be done immediately. And that's my
Thank
motion.
you, Tim.
Commissioner Ivey.
I second that motion.
Commissioner Patter, any discussion?
And you said specifically from the COVID allocation?
Mhm.
Yes,
Okay.
yes.
From the American Rescue.
Yes.
Any other discussion? Being none, all in favor, signify by saying aye.
Aye.
Aye. Any opposed? Ayes have it. Thank you very much.
Thank you so much. Thank you. I'll make you proud. I promise. Thank you.
Churches are meeting virtually, that's why churches quit. They're meeting virtually
Uh,
for the last 2 years.
Yeah.
Good evening. So give you a recap of 2021, where we finished up at the fiscal year end. We had budgeted revenues of $51,529,292. Of that, we had allocated 4.2 million of fund balance. We actually brought in $47,302,044, which is 92% of our budget. We had total expenditures of $47,249,054, which is also 92% of our budget, and we had a surplus of $52,990. Our fund balance at the beginning of July of 20 was 18.7 million, which is 21% of unrestricted, and ending June 30 of 21 had 18.8 million, which is almost 24% unrestricted. Questions?
Oh, I was waiting on you to
I'm
say
sorry,
something
I-
else. So, Bill, what, we collected almost $2 million more in sales tax than we had budgeted.
We did. We budgeted conservatively, not knowing
I
where we
know.
were going with
Yeah, yeah.
COVID. And
I remember that, but
we
I
collected-
didn't know it was that much. I knew we collected more, but I didn't know it was that much.
Yes, sir.
So,
How much over are we in what the state requires to have
So
balance?
from the LGC?
Yeah.
So for a county our size, 24% is where we're supposed to be. And as I was telling Mr. Patterson earlier, that the LGC has changed their ruling. So they're looking more at a budgetary basis of keeping fund balance on track versus a population. So once that ruling comes down, this number may be different as far as what our
But we're
requirements are.
slightly 1% off. You say it's 23, and it's supposed to be 24.
Yes, it rounded
I
up
didn't- Okay.
Yes, sir.
Okay.
but the state law is what, 8%?
percent.
And then the county rule is 16%,
Correct.
correct?
Okay.
With that, the state rule is an 8% minimum, which is one month cash flow,
Okay.
which, as Ginger was alluding to it, if we're that low, we're figuring out what to pay and what not to
Yeah.
pay.
Okay.
16%, below 16%, the budget recommendations is always going to be some way of increasing fund balance. When we hit at a 24%, that point in time, the budget policy that you passed would be to find ways of, greater use of fund balance. So
The 4.2 that was allocated in the budgeted previous, was that for a particular purpose?
So, yes, sir. So the majority of that is the Laurel Hill Community Center. We had budgeted 2.5 million, if I'm not mistaken, of fund balance to cover that project.
So we don't have to take that hit this year on the financial statement.
That's
Right.
correct.
Gotcha. Okay, that makes sense.
and then the other items were capital items that were put in then
And then-
our operating
Right.
revenue.
Gotcha. Okay.
Yep.
I'm good if y'all were good.
Any other questions? Okay, thank you, ma'am.
All right, thank you.
I will ask you, Mr. Chairman, is it customary that we wait until November to hear this report from June? Is that how we normally do it? I'm just asking.
Oh, ask Kevin.
I think it normally takes that long to get it all
I was
finalized.
gonna
Yeah.
say, you don't have it before then.
With these, this is with, we can do a preliminary, but with them, it takes us at least 90 days before we know what our sales tax receivables are going to be, because through the September sales tax actually goes back into last year. So it takes this while before we have a certain trial balance ready. So these numbers are, at this point in time, are not going to change.
Gotcha. Okay.
Just made a second question, but one of the concerns I might have is that, you know, we've often gotten criticism from the GLC, LGC, because of our not getting our information in on time. Are we gonna be better this year than we were last year?
Right now, October 17th, around October 17th, I sent the trial balance to the auditor, and also sent the schedule of expenditures for federal and state awards last week. So he has the two major pieces to get started. So those are in his court right now, so we're waiting for him to schedule time for us.
And we were saying that, you're talking about Mr. Head.
Yes, sir.
Okay.
And the schedule of federal awards, you've also sent the draft copy to the LGC for their initial review as well.
Mhm.
If I may, to the board, does anyone have any objection if I skip down to item number 11? Eli Caldwell has been with us since about 6:30. I'm gonna move to that point on the agenda unless there's some objection.
No problem.
Eli, if you come forward, please. Now, you're welcome to stay with us after you give your report, but we might get you out of here a little early if you want to.
Thank you. Appreciate it. I'm not going to take that much time. So we essentially see the metrics, which they put us at 9.46%, a little bit more above the 5.0% for us to be able to kind of make some changes. So we'll be looking at the transmission rate for days to be less than 9.4% in order to place us in the low risks. But as of today, we are in the substantial risk area. That's just what the map is telling you. And the red is just high. So that's what on that graph. Kevin, is that autographed?
That was it.
Okay, so as of today, we have had about 5,870 total cases of COVID and 108 deaths. Active cases, we have about 44, and active cases among school-aged children, we have about 13, and then breakthrough cases is about 104. So again, I'm still kind of looking at probably leaving a mask mandate into place, because I'm looking at what is going to happen after the holiday. So I don't want to rush it too much to say now lift the mask mandate and then come back again and say, well, this is what the data is showing, the trends has changed. So I guess, I'm kind of moving towards, at least if you can do it month to month, and then if that changed to below 5%, then we'll be in a better position to recommend that, to ease the mask mandate. But again, with the forecast we are seeing, because we did run a forecast, if we do use the mask after the holiday, then the transmission rate wouldn't be that bad. But if everyone is not using the mask, then we are seeing that the trend may a little bit change. There's going to be a little bit increase, some spike in the transmission rate, but it may not be too high. But the mask will be very useful And now I think the FDA has authorized the Pfizer vaccine for children from 5 to 11. The CDC is going to be meeting tomorrow. If they can approve that, then that would be at least an advantage for us here. So again, I think I would still consider putting the mask mandate for additional 1 month again and see.
Any other information for us?
No, that's it.
When will the booster shot be available? Is the health department administering it now?
The what?
Booster shot.
The booster shot. Yes.
Yeah, administering it at the health department.
So we are not taking appointment. The health department is not taking appointment for booster shot. Yes. So if anybody needs a booster shot, they can call and make an appointment, or they can also go to the American Legion, 50th American Legion post. They are also offering that, or Walgreens, or Walmart. Yeah. So those areas are offering that.
Do you have both the Pfizer and the Moderna?
Now we just have the Moderna.
Are you seeing still a lot of activity at the American Legion site, or has it died down? And the booster, is a lot of people showing interest?
In fact, yes. We have had too many calls about the booster shot at the health department. So there is a lot of interest in it. And the American Legion Post, I think it was very useful for us to open that site because we have done too many vaccinations, and then we have been really doing a lot of testing. And I think initially I was thinking of putting that into place for 6 months, but considering the need for it, I think I would like to go beyond the 6 months because we are doing a lot of testing and a lot of vaccine. So I think it's going to be to the benefit of the community if we can continue to test. And if this can, because I'm actually, one of the things I'm looking at paying close attention to that 9.4%. If that can change, and then if I run a model again and see that we're not going to run into trouble, then obviously I always send email to Kevin and say, and let you know that, yeah, we are on a good side. But I always run a model to see. Every month I run a model and see.
Well, how many did well, maybe I'm worded that wrong. Did we not have about 200 active cases when we first did this? This mask mandate?
Yeah, we did.
And we're down to 40 now?
Yes, we are down to 44. But if you do the math according to the CDC, that is displaced us to 290 per 100,000 cases. So that means that's why our number is still high.
I get why they do that. I mean, I don't want to take away that it is down. I mean, I know it's not in some of that percentage number there, but in actual cases, we are down. Has the health board decided to do any? You know, one time we talked about the health board doing whatever. Have they decided to do anything, or have they not decided? I haven't heard anything from them, so I don't. The Board of Health.
The Board of Health, it's a little more complicated, and I'm not in a position to really go deep down that route, because my understanding from that is there's some sort of like a political issues going on, and I do completely understand that because we all have our own opinion to voice when it comes to things like this, and the reason why I'm more leaning towards, because I think you are doing the right thing. Let me just put it this way. Commissioners, you are doing the right thing. If we didn't do what we did when I came here, when we ran a model, 71% of the population here was infected, according to the model we ran. So if we didn't put these things into place, we were going to be a little bit into this different spot. So the mask has helped and the vaccination has helped, but I'm leaning more towards both the Board of Health and the Board of Commissioner. But if any of the board can really kind of keep this the way it is for now, that would be, I think, to the benefit of the community. I think so.
Take my blood pressure, it's 9 o'clock.
Do we have a preference of the board in regard to the extending the mask?
I offer a motion that we maintain our present state status and keep the mask mandate, and we revisit it at our December meeting.
And I think it's currently through November the 12th. So it would be extended through
December 10th.
December 10th.
Okay, that's perfect.
Second.
So,
We have a motion from Commissioner BJ Gibson and a second from Commissioner McFadden. Any other discussion? All in favor of extending the mandate till December the 10th, signify by saying aye.
Aye.
Any opposed, say nay. The ayes have it. Thank you very much.
All right.
Thank you, sir.
thank you.
We will go back to number 6.
RULAC bylaws. You have a copy of the bylaws. RULAC is multi-county agency surround, all the border counties surrounding Fort Bragg and Camp McCall. It is, at least for now, it is an environmental and zoning agency with them. They have modified the bylaws and need ratification from the from each of the counties that are members. Those bylaws are attached, and these are probably one of the first major bylaw updates in a while, because originally RULAC, or at least this, well, I'm thinking something else, but some of this is just adding in the definitive partners that they have and some minor modifications in their activities. But, if there are any, these bylaws changes were the recommendation, and they're seeking approval for the change from all of the member counties.
I was glad to see that Commissioner McLaughlin from Wakem is a I guess he's our representative, right? That's the only one I saw that I remember. But it really, being a part of this doesn't affect us really one way or the other, does it? Only thing I'm worried about is constant bumming and shaking my windows in my house.
Right.
That we always have that problem being that close to Fort Bragg. But are we affected by all this that they sent us? I mean, how?
On some zoning issues.
Some
Yeah.
zoning issues. Yeah.
This zoning is the primary.
Zoning is
concern.
okay. Yeah, I understand that. Yeah.
I don't
It should
think
be a
anything
C.
causes us a real problem in rezoning.
Uh,
I think it just have to be notified. by-
Yeah. Or the only time they ever made comment that I can remember is we had a cell phone tower that wanted to go up near the, up near Camp McCall,
Yeah.
up by the fire tower.
Yeah.
And they wound up moving that a few hundred yards, I think. So it was outside of a flight path.
I just want to know, did every commissioner read all that? I'll be honest, I didn't. I briefed through it. It's a lot of writing. Did you read it, John?
Yes,
A little bit of it.
We're looking for a
It was
motion
fun
to
reading,
approve.
wasn't it?
Yes, sir.
We're approving the resolution, right?
Yes, sir. It's approved by resolution.
Then I'll make the motion to approve the RULAC resolution as
I'll second.
attached in our agenda.
We have a motion by Commissioner Ivey, a second by Commissioner McCall. Any discussion? All in favor, say aye.
Aye.
Opposed, say nay. The ayes have it. Thank you very much. Record retention policy.
This has got my name on it, but I just, oh, well, thank you, Jason. Yeah. The only reason I brought this up was in our other committee, and I sure don't want to go back into that. It came up about record retention and email retention. And there is a state law, and I'm not going to quote the number here. I don't have it with me, but it's 137 pages of fun reading if you'd like to read it. That was adopted in March of 2019 by the state, and we approved and accepted that in the consent agenda in, I think, May of 2019, shortly thereafter that. So I think also, though, there's probably room in there for it to be tweaked a little bit because, and we went into this thing about emails and stuff like that gone, and all of us here are losing emails if we don't move them into a certain folder. And if, my presumption was that even though I hit it, delete or move it out of my inbox, that it would stay in that trash bin forever until I got rid of it. And that's not happening. After 30 days, it goes and you can't retrieve it. So we either need to have a system, a server or a terabyte, or we pay Google to do it for us, probably the better way to do it, to maintain all that stuff. No matter what you do, you can hit delete, wipe, do whatever, and it's not going to go away. And maybe the policy committee needs to meet on that, but we need to have a system in place because it is and I don't know the class, but it is a misdemeanor to destroy an email, and any email you send with your county is a public email. And I just assumed that we were doing that, but I found out different lately. But anyway, that's the only reason I wanted to bring it up, was to see how you wanted to do that. But I think we need to make sure everybody that's with the county understands this email policy and the retention of those documents, and the importance of those documents.
Yeah, I don't know the answer to this, so I want to ask it. It's your belief that what the state wanted us to adopt and what we adopted would require us to keep those emails longer than what we are currently doing. So we need some kind of systematic fix.
Right. And there's systems to do that. I mean,
So
we're not going to have to reinvent the wheel here. But we're going to have to make that happen and be it maintained by our own server or a Google server or whoever you want to do it with. But because that's going to take room, it's going to take terabytes of drive. But of course, you can put terabytes of drive now on the top of that little water bottle. So, but I just thought I'd bring it to the attention that we're going to have to do something to enforce that policy that we already have adopted, but we don't have a system in place to follow that right now. So.
Couple of things. First of all, that's why we updated our Google, because I was one of those people, I kept running out of space on my email. But that, and again, we updated it again this fiscal year. So we added the vault so we can keep emails. Now it's still set up. If you delete and move an email into your deleted folder, it is gone after 30 days. But if you don't delete it, if you archive it, it goes into your all mail. So it's not in your inbox. But our vault is supposed to just maintain that to an unlimited amount right now. Also, and I think this came out last week, the archives have just sent out a new list, a new retention schedule. And that will be on the December agenda. One thing that they changed in the current agenda, in the current records retention, is they use the term administrative value. You keep something as long as it has administrative value. And administrative value is not defined. So that's something that the board can define. However, in the new term that we're going to bring to you next month for exception, they've gotten rid of the term administrative value and are now using reference value. And my understanding is they do not define reference value. So that would be something that this committee, the board can define. If you want to have the policy committee define reference value, or take it on as a whole. Because with that, otherwise you adopt their policy, and that's one area you can define, but you adopt their policy or you come up with a brand new record retention schedule. As Commissioner Ivey mentioned, it's 100 and something pages. So we probably don't want to go back over all of that, but coming in and defining what that reference schedule is, reference value, can be used.
Yeah. And I, like I said, I don't want to reinvent the wheel here, but I think we need to have a plug in this system to where if John deletes an email that it don't just disappear in 30 days. Even if he goes in there and deletes it out of his trash box, delete forever, it's going to be captured somewhere and can be scrubbed at a later date. I think that's the whole, because right now we can, you can delete your email and it's gone. And there's a way to do that. And I've that email retention is a big thing, and it doesn't just talk about emails. There's a lot of other record retentions in there, letters and that kind of thing. But I just think we need to start. I think that hole is easy to fix, to stop it where it deletes forever. Then you got to decide how much you're going to keep where and where you're going to keep it. Is it going to be on our server? Is it going to be on Google server? That's the kind of stuff you can fix later. But that other leak, that other hole you can plug now. It's going to take more room. It's going to take more Google money, but I mean, it's not going to be a fortune to do that, but something we need to look
We
at.
can see
State
from
law
the map we
requires
need to do that. And that's why we upgraded that this past year.
Well, and we were talking about defining administrative need or I'm not going to make that decision. I want it so if I delete it, it goes somewhere that somebody else can retrieve it.
Right, that's what I want.
Well, and that's what I'm saying here. Right now, if I want to hide an email and forget about the vaults and the folders and all that stuff, then I can go in and delete it and it is gone. You cannot retrieve it right now unless I were to move it into a vault. I think what I'm trying to say is we need to take that to where it doesn't matter what you do. You hit delete all you want and move it wherever. It's going to be there for somebody to find if whatever needs
That's
to be.
important to have.
Right.
So I would think we just request that the county manager look into that, what it's going to cost to come up with the simplest and easiest solution.
And I've had conversations with the IT director about that already. She's been working with them. The question, but the reference value definition still needs to be there. And it can be something fairly simple for emails. We want to keep, in general, we want to keep it here because if it's for active projects or certain things, it's spelled out, but the general communications are there. Because otherwise, also part of it is going to be, all the emails. I get 200 emails a day. Half of them want to sell me something. And those will fill up that vault too. And so if we just have a practice, when something is 4 years old, if we've not done something else with it, it can go away. Because we don't need to go off and find out that Lenovo laptops are on sale today, 10 years from now.
We just need better spam filters.
Yeah.
But that's all I wanted to know about that. So
Oh, I'm not even looking at my spam folder. I've only got a little over 19,000 emails in my inbox right now. So, but that'll come back up next. That will be on the consent agenda next week. And we will need to look at a definition for retention value also, or reference value. Sorry.
All right.
Johnson, I'll start and then have the committee. With that in here, in your packet is a project ordinance from Johnson. It is based on basically the recommendation that I gave you on a tiered structure. With this one, it is over a 4-year cycle, starting with the first year of this year. Looking at $400,000, that would be the approximate amount to get the gym operational. But $2.6 million over the term. If you do this, this does not appropriate fund balance of $2.6 million. That would still be an annual budget decision by the board. So this is a recommendation on the project ordinance on how it's moving forward. And also this would be kind of a plan for the commissioners to say, this is how we want things to progress. I present this information to the board, and with this is also where we can go ahead and start doing the bids on the roof and the roof, bathrooms, and painting in the gym to get that project started.
And hiring a director.
And that's outside of this. This is just the capital aspect. But we'll need to.
Oh, I thought all that was in this because
is
it wasn't
the-
originally 400. It was like 360.
Yeah.
But I mean, am I right?
That's right. That's
Yeah.
what my thought was.
And some of it is balanced, is just rounded up for the total project.
Right.
And this can be amended as we go.
Well, so to go back to the IEJ committee, where we are now is the city has approved to pay utilities, light, water, sewer,
Refuse.
and trash up to $50,000 a year. And said they would agree at looking at their contribution in demolishing the other buildings, not this budget year, but maybe in the next budget year. So they have agreed to that. We know what the schools have agreed to do. And right now we're waiting. We've asked Mr. Graham at Parks and Rec to come together with a plan to get that gym operational, how he'd want to use it, what he wants to do with it, how he would run it, that type of thing. And I think you would ask Kevin about the project timeline and also the director position for that. So that's where the committee is now. We have another meeting scheduled, but I don't.
You said
It's this month.
what the schools had agreed to do. What did the schools agree
To give us the building. For
to?
that
Where
is
are we in that process?
my understanding. Okay, yeah, they don't have the deed yet. So, and then there was also going to be a request after all that about the attorneys getting together on a letter of memorandum about who's going to be responsible for what and that kind of thing.
Among, what group?
The school board attorney, the city attorney, and yourself. But I don't think they're ready for that yet. But that was one of the steps in the process. So I think we need to have that done before we do the deed. So before we actually accept the deed. Yeah, right.
I have a question, but in what I have read and heard and listened to about the city's contribution is that it's up for 2 years. So they will have to revisit that contribution after 2 years. Is that correct?
That's what I'm saying I had.
Yeah.
Okay, so we know that we have a 2-year commitment from the city of 50,000, up to 50,000 for 2 years. And after that, we hope we get another commitment. Is that right?
Correct.
Okay. And my other question is about the director. What timeline did the committee envision hiring a director?
I don't know that we put a date on it. We assumed that it would probably be done. The search would begin right away. And then by the first of the year, you maybe could have somebody in place, because that's not going to be your normal position to find somebody that's qualified to do that. But by then also we should have the stuff underway in the gym, but that person could be in planning what we're going to do, how, where, getting the building up operational and that kind of thing. So
Because I guess my question is, you're going to hire a director, but there's nothing to direct.
that's the director's position
Director's gonna be hired to
is-
figure out what there is to direct.
well, no, that's twisting it out of,
I'm
that's,
not trying to.
yeah, it is. It's coming out that way.
Well,
But the director's position is we're going to identify the programs that are going to be there, and it'll be the director's job to get that organized to make those things happen in that order and have their own idea of what's going on. So
we would give them direction on what we wanted to be,
oh, absolutely, yeah.
programs and the activities. and the director would be responsible for developing all that.
That's right.
Okay, I just wanted to know.
And one of along that same line, one of the conversation our committee has had, and we kind of mentioned it to Mr. Johnson, was just about how do we develop that committee to make it more official, and the possibility of adding kind of like the DSS board and the Board of Health and EDC board has public participation as well, or public members. We just kind of threw that idea out as well, just so that we make sure that when we're developing what that vision is to pass on to the director, it's concrete, it comes with some authority, and that there is some public input. But I think we're going to discuss that a little further in
In the next meeting, yeah, which is this month, but I think it's the 17th or something like.
It's the 10th. Yeah, the 10th.
Oh, it's the same day as the other meeting, but it's that later that day. Okay.
And I will go ahead and let you know, a conversation that Brian Graham and I did have is right now what we're looking at is probably until there's more guidance, and we are still some time out because you can't start using the gym until it's operational. But probably looking to very similar activities as what's currently in Wagram, and what will be in Laurel Hill. So we will be looking at probably 2.5 employees for the recreational activities in that facility. And see exactly how we're going with that. And that would include open on Saturdays, modified schedule. So there are some afternoon, early evening hours. But we would see how that's done. And of course, it would be worked into the schedule for especially indoor athletics for Parks and Recreation as well. So Parks and Recreation is working on that, but we will have a timeline once we get permission to move ahead, get everything else to move ahead and get in line, so we can start the renovations of the gym.
Going back to what you started with, is it your suggestion that we take some action on this ordinance?
Until you adopt until you adopt a project ordinance,
Can't spend no money on it.
I can't put any money in. And I will let you know, I went ahead and I had finance go ahead and turn the utilities over to the county. To the county. So in this month, when the utility bills come, we're paying those.
City's supposed to do that.
Those come out of our operating account. This is before we can actually do any repairs. We've also had our maintenance crews over there. They've done some work on the outside. They're looking at
That's why
some
I said I wanna
repairs
have the
that
deed
need
first.
to be made to, especially plumbing, draining, roof repairs that absolutely have to be made. Anything that we can make internally, we've done with our manpower because there's not a direct cost, or it's an incidental direct cost. We are waiting to get a repair quote back on a plumber that we need to get in and clean out a roof drain that we don't have access, we don't have the equipment to clean.
As it relates to the deed, who's handling that conversation? You, Mr. Johnson, or you?
Well, I will be, but do we have to have what you were talking about in place?
That would be one of the things, the memo of understanding, I think is what they're calling it. But,
The school board has some kind of discussion about something related to that with regard to the rent or their annual payment on the new school, and there was some comment made about that.
I heard about that.
You haven't heard about it? Sorry, I don't know what you're talking about. Well, it was in the newspaper, they were surprised that they had a $1.8 million payment.
Oh, Yeah, well, I mean, I heard that, but none of that made sense to me, so.
But I don't think that's connected to this.
Well, one of the board members, I think, made a
They
comment.
alluded to.
Yeah, I heard that. Too,
Yeah,
but
but
not
that-
officially. Officially, what the understanding we have from our committee though is that our attorneys would get together with our managers and superintendent or whoever and create a memorandum of understanding so that it's spelled out black and white what the city has committed to, so that that's
Basically, the school's commitment is to give us
to give us the
the
building.
property,
Yes.
For the first year,
wasn't it?
for the first year. But then they'll discuss what after that point, because I think they want to see too what,
Down the road, adding some
like,
services.
what their programs they're going to want to use in
Right.
there, so.
But their initial investment is they're giving us the building back.
Do you want that MOU in place before the deed is done?
It sounded like.
I'll leave that to,
I would have had it all in place before I did anything, so, but I mean, that's whatever's the easiest way here, but.
Floyd and the school board attorney.
if you would take care of that for us, we appreciate it. That gets it moving.
I probably dropped the ball on that. 'cause
I know.
Probably should have said
I don't know if
something.
you've had any chance, but I know North Laurinburg, they're still having fun creating a deed on it.
They got it. They finally
They
closed
finally
on
got
it.
it?
Yeah,
It was in the paper last week.
Okay.
closed
Well,
on it.
The school's attorney being in Raleigh, I'm not sure how familiar they are with the real property.
Right. And I bring that up only because there could easily be some extra challenges to these deeds versus
Oh, sorry.
the deed I'll work on my house was fairly simple.
I think the problem was they couldn't find a deed.
Yeah,
Yes.
They-
Yeah,
That's probably true. Yeah.
couldn't find a recorded deed.
And I guess that would be a question, because if that comes back, and again, it can slap me later, assuming we cannot find a deed again, would this board be amenable to a quitclaim deed or something along that line?
can you
But
say that again, Kevin?
Assuming that there is no deed, recorded deed on Johnson,
Probably not.
would this board be,
I hope that's an inaccurate assumption.
I hope so, but
Why would
Yeah,
there not be a deed?
there wasn't one on
North
North
Lumber
Laurinburg.
didn't have one.
You going back to
That's the old
1960,
school.
51.
there is one on Laurel Hill though, by the way.
Well,
Yes.
yeah.
I've seen that.
But for Covington
I ain't
Street,
looked
there
at the
were
one on
multiple-
AJ.
multiple.
I assume there's some kind of legal maneuver is the word I want to use, maybe, that since the school's been there since 19 whatever,
51.
that,
What a quitclaim deed is.
yeah.
Yes.
Well, maybe that's what I don't use I know what a quick client, anyway, I assume there's a procedure for getting that straight somehow.
I just hope that the
Probably is, but I know the one in Laurel Hill has one, or the Laurel Hill where the rec center is going to be, but who knows when it didn't get recorded back in, like I said, there's got to be some way to fix that. School's been sitting there for 50 years. Somebody can't come up now and claim it saying, oh, I didn't sell that property to you or give it to you or whatever. So
so that's their attorney for that funds.
If you want to wait until we have an MOU and a deed work before you approve this, we can just table.
You said we're gonna start paying the light bill January, December,
We would start paying the light bill next month.
December.
yeah,
With no deed.
I just don't want to start anything on it until we have the deed and that memo of understanding in place.
You'll just table this right.
And it's not because I think they'll back out, but I think that's the safest way to do it.
Well, we talked about participation by other folks, and I'm not seeing a great deal of participation by other folks.
Right.
now. Although I'm not sure that's going to change either.
And if we could stop the utility thing until we get that done, but I hate to go back and ask somebody to redo that, but, anyway.
move to Laurel Hill. Laurel Hill, if you've been out there, the grading company has started work on the pad, so there is fresh dirt out there. With that, we are looking to have the groundbreaking, the ceremonial groundbreaking, this Friday at 9 o'clock. If any commissioners are able to attend, strongly encourage it. That was just the best time to fit as many people as possible. So that's the big thing. Now, also the existing building that is there,
The little white building.
the small brick
Mm,
building
okay, mhm,
down there where the nutrition site, the congregate nutrition site is.
okay.
We did have an issue. We knew we were going to have to move the water line, but during the site preparation, it was busted. We went ahead and installed the new water meter for the new building, and then ran a temporary water line off the construction site to the new building. So it had water again last week. But the question of it is, Parks and Recreation is still looking to find a different location for the congregate nutrition site. Just because having them during construction can be disruptive towards them. The construction company is going to have a 6-foot chain link fence around the construction site to discourage people from entering. So if any of you want to look at the site and actually go on site, but right now there's nothing to see for a while, let me know and we'll schedule a time to go out there, because if you go out there, they will run you off if they don't know who you are. And also, it's not necessarily safe if you're out there with a backhoe run.
Go there with John, everybody knows John.
So, but with that, the decision was made to keep that existing building until the new building was built. But now we do have, with there, I'd like to go ahead and get a timeline on removing that building. One thing in the layout, that the site of that existing building is where the pickleball court would be. It can be moved, but that's just a good site according to the architect. And one thing we'd like to go ahead and look to do is if we can coordinate its demolition while construction is still going on, so the entire facility will be finished at one time. And with that, because we know there is asbestos in there, and it will take us time to remove the asbestos and then get it, and then do a demolition in time. So looking for a potential window for looking to demolish that existing building. I know the question has also come up about Laurel Fest. I know Brian Graham's also reached out to some of the coordinators of Laurel Fest and at least brought up the idea of them moving it from the spring to the fall till the building is actually finished, and at which point in time they could use the facility. Because it is a Saturday event and the
Yes.
building will be open on Saturday, so it would make a good use for Laurel Hill.
That's a brilliant idea.
Um,
They'll go for it.
Well, I got the calls from the Laurel Fest people and from the Laurel Hill about all of that. And, we discussed that building when we voted on having this building and said we would leave it there until we were done. Then we would decide afterwards what we would do. And, the Laurel Fest people are counting on having it there at their time they've scheduled it. If you tear that building down, it takes away all the power source that they have for all those little poles around the building. All that stuff goes away. And I don't see a need to tear that building down until we know we can or can't use, because you can use a pickleball court anywhere out there. But of spending the money on tearing that down yet until we know for sure, because I mean, we may come up with some great use for that building between now and then. And but those Laurel Fest folks and the other ones that's following this community center are against removing it right now. And I said, you know, I didn't make any promise in the future. I just said my discussions I remembered us having was that we weren't going to do anything with it until the new one was built, and then we would go from there. So,
And also with it, the building was scheduled to be delivered, the steel is scheduled to be delivered in February.
right.
So no, there's no need to try to demolish it next week.
Well, even by the time, if they delivered in February, by the time Laurel Fest happens, they're gonna be done with the outside of that building. There'll be interior stuff going on, and I'm sure they'll still have it fenced off, but they're not gonna.
Mother's Day, don't they? Is it
Yeah, it's Mother's Day
weekend?
or Mother's Day weekend. And so I don't think anything in construction wise is going to affect Laurel Fest. I mean, they didn't use that part anyway, but that's just what I've heard from the community. So,
But that can be something if we look to do, get in there Laurel Fest or after and we'll need to do the asbestos abatement either way if we're going to start in there.
I just personally, I wouldn't do anything to it until the other one was in, it was operational, and then we saw what was going on. Because if we go in there and start asbestos abatement now, we've committed to tearing it down.
Oh, well,
And plus
I wouldn't
they
do
can't
that
use it
necessarily
again.
until, you can easily do that after Laurel Fest.
Oh, I would just wait till the new building's there. That's my personal opinion, y'all.
I just hope that whenever we decide whatever, that we make it public. I got 1 million calls
I did too.
about a week ago from the Laurel Hill citizens that there was a bulldozer there. They were about to tear the building down. The nutrition site people had nowhere to go. I was, of course, lost. But I do ask that whatever we decide to do, we make sure that, you know, we make it public and especially the people who are directly affected by it, which is the nutrition site people. And I think the sheriff's department, you know, we communicate with them before we send a bulldozer.
And the
out there to
book
tear it down.
exchange, the book exchange, I guess still works.
And that's in
I don't know what the plan was initially for the building, you know, to be torn down or not, but listen to the conversation. I don't think it's an immediate need. What that sound like it is.
And with the sheriff's office, because they have a gym, weight room in
Exercises.
there, part of that is I would look to probably transfer that equipment over to Johnson and because there are also rooms that have exterior doors.
Right.
So we could give them a key to
Access them to.
so they have access to that part. And then that also gives visibility in Johnson.
Kevin, there would be no crisis if we did not do anything to that building until
No,
June.
sir.
Why don't we make the decision to leave that building?
Just leave it alone until the new one's up and we'll decide.
There may be a time before we get operational that we want to take it down, but for the next, now till.
We have good.
Let's leave it like it is.
Yeah.
Agreed.
I agree.
And that and plus, once you have steel going up, you're going to have those people, oh, they're just going to tear it down and give us nothing.
Well, but I think they need to understand, and I said this because when I first heard about it, I thought maybe this had something to do with it, that they are going to have to leave that building for a while when the new septic system, the old one's taken out, the new one's because they're not going to have septic system. So they do need to know that, but.
Let's make a decision here that we're not going to take any, the building's going to stay like it is. Well, is it back operational?
It is.
Okay, from now until at least June 1st.
Okay.
And we will make it, we will reconsider it on June 1st.
Right.
We're not saying we're going to do anything different on June 1st. We're certainly not going to do anything before June 1st. Okay.
All right.
I'm sorry. Anything else on Laurel Hill?
That's it.
You want me to do appointments now?
Yes.
Oh, okay, I didn't look at the board. Okay, quickly, we have only one person for each one of the appointments. We have, Summer Woodside for East Point area. She wants to do East Point. Quite a bit of travel. She wants to do East Point. And, I move that we, appoint her to the East Point area board.
You want to do these one at a time?
Yeah.
Okay. Is any that you are nominating, that we appoint her to that board?
Yeah.
A second.
You have a second? Any discussion? Hearing none, all in favor, say aye.
Aye.
Any opposed, say nay. Ayes have it. Thank you.
Okay, then we have, Betty Mitchell that wants to be on the Asian Advisory Committee. I guess I can combine the next two.
Go ahead.
And then, Matthew Locklear for the Transportation Advisory Board. So I move that those two persons be appointed to those each individual boards.
Is there a second?
Second.
Second by Commissioner BJ Gibson. Any discussion? All in favor signify by saying aye.
Aye.
Any opposed, say nay. Ayes have it. Thank you very much. Thank you, Betty.
Okay, two fairly quick things. One is the board meeting schedule, which is normally on the consent agenda. But we did not put it on the consent agenda, just bringing up the idea. And of course, this is your meeting decision. It's, whatever. But is there a consideration for changing the start time from 7 o'clock to 6 o'clock? That puts it in line with Board of Education, City Hall. As you know, especially now that we're also streaming our meetings on YouTube. It makes it fairly easy with that, but that still gives an hour for someone who leaves a 5 o'clock or 5:30 job to still attend the meeting. But it can reduce our 10 o'clock meeting.
I like the idea. I've been wondering why we hadn't done it, so that's great.
Like Kelly said, the consideration of people, getting off at 5. But like I say, I'd like to see that 6 too. I'll be in favor of it too.
Do we need action? You want a formal?
There is a resolution that has to be done when you're changing the standard meeting.
Well, I'll make a motion that we change our meeting time from 7 PM to 6 PM.
When is that effective though?
It would be January.
Okay.
I second that motion.
We have a motion and a second. Any other discussion? Anybody think of a negative reason why that's?
ABC board meets here normally at 5:30, but they voted today to change theirs back to 5 as well. So it should be enough time.
I meant to bring that up.
It's
Who meets
normally
here at 5:30?
ABC board.
Yeah,
do
do
they?
it 30 minutes,
Yeah, it don't take 30 minutes usually.
really?
Yeah.
We'll have,
Water would go to 5:30, I guess.
yeah, we'll have to adjust the water board meeting.
That's good.
Mr. Chairman, you didn't ask me my opinion.
That's right.
Yes, Joe. I will be.
I don't want to tell you that you don't count, sir.
You can stay on and.
What's
come
your
back
name?
with-
What's your name? No.
We have a motion and a second. Any further discussion? Hearing none, all in favor, say aye.
Aye.
Opposed, say nay. Unanimous, the ayes have it.
Okay, one other thing, of course, the opioid settlement the participation agreement has to be signed by January 1st. It is a very simple survey that has to be filled out to participate with that, or at least to register to participate with that. But there is one very important question. Who do you want to sign? Do you want the county manager or the county attorney to sign those documents?
How much we getting? Can you tell that? Or do you know?
The number I saw several months ago, over the next 18 years,
18 years.
18 years is about $3.4 million.
Over 18 years.
Over
Over
18
18 years.
That's not a lot of money.
And I'm not sure exactly how all of that is broken up, but when it came to our percentage, I never saw a decimal go that many places.
I would assume that whatever this document is going to look like, that our attorney will review it.
Yes. And of course, it would also be reviewed by our attorneys who are representing us in the suit as well. Yes.
My way of thinking that if Ed's gonna review it, I think I'd rather have somebody other than Ed sign.
That's my thinking too.
Are we comfortable with Ed review it and the county manager sign?
County manager.
Fine.
That's the way we do most documents.
Does that need to be a motion in a second?
No, if you approve, I'll go on and I'll register us tomorrow for that. The registration is simple. Thereafter, it's going to be that. And with that, the documents, again, are prepared on a national and state level. There's not going to be a great opportunity for us to parse commas. The,
That's what came to my mind.
the one last thing, I did not put it on the agenda. I was thinking this was not a significant issue when I was doing this. Then later on, I found out that, I knew the Board of Education would have a conversation, but it seemed more serious when reported from them. We had a meeting last week, or there was a meeting last week talking about a potential housing program that school was interested in. The State Employees Credit Union has a program where they have zero interest or low interest loans to organizations that are building houses, apartments, not houses, housing for teachers in the state. The school is interested. They know that this program has been successful in other places. The schools, two people from the schools invited myself, Mark Ward and Charles Nichols to the meeting as a introductory brainstorming meeting to figure out what it is. We did have a number of questions. One of them is we needed to see a prospectus on exactly what they're looking to do, where the income and expenditures. They're looking at a potential 24 apartment complex for about $3.2 million. With that, but the state employees credit union wants about approximately a 20%, or they came up with a number, $850,000 local buy-in. We did discuss the political difficulties on getting those local funds, but thereafter also the need for a prospective financial financial statements going forward, so we can look to see how any of this would cash flow. We left there with a number of questions. One of the things was brought up was that the committee that was there, one of the members was also Mr. Jackson Funeral Home. But the conversation came up that committee would form a nonprofit organization, and that committee would be the board members. The idea that Mark Ward actually brought up the idea before I did, but brought up the idea that he, myself, or Charles Nichols would most likely not be able to be board members on that board, because thereafter the request would come back to the city and the county for funding, and that's not going to happen. Or I'm not going to be a board member that's requesting funding from this board. But from my perspective, from the perspective of Charles Nichols, it was more a let's discuss this brainstorming activity. This was not us. We're moving way ahead on this. I think there's a lot of information that still has to be developed before anybody can take any action on it. So
Kevin, I thank you for giving us all that information, because I've had people ask me about it, because the reporting on the radio and in the paper was that they hope to have it all worked out and be by December, and wanted to know what the county was going to have to put into the down payment. And I said, hold your horses there. I said, neither Charles Nichols nor Kevin Patterson can authorize any money going into it. They got to have votes from the city council and from the county commissioners. So I think that us having a better idea of what this is about can help clarify it as we go about our business in the public, because both the radio and the paper, if any of y'all heard or read it, I mean, it was like, let's go, partners in place, you know, and it's not quite that way.
By December 31st, I do think, depending on how, they could have board members selected, and they could have an application into the IRS for their nonprofit status.
Yeah.
Thereafter, IRS can be funny sometimes. They can get it turned back around in 3 months. And that would create an entity that would hold the loan, but there's still a lot of information that still has to be developed as for how this would be a ongoing, self-sustaining financial entity.
People asking me like, are the county going to have to spend money on this? And I said, I don't know. So we'll see.
So
Did they straighten out their indebtedness from the new school? They get all that straightened out now. They understand everything with that.
I'm scheduled to have another meeting with them. I think November 10th. No,
It was in the
November
paper.
8th.
I mean, I didn't dream this up. It wasn't.
But I'm gonna have a follow-up meeting with them, and I'm not sure exactly where they are. But I don't want to go in there and at some point in time, it may be this way, but go in there and be more of the bull in the china shop in there. I think we're not to that point at this point in time.
Okay.
There was a meeting about 3 weeks ago with Dr. LeGrand, Kevin, and the chairs, and we had a discussion, and I did not. I obviously had no. I can't commit us to anything, and I basically told them that when they came up with this plan, they had an idea of the savings that would be made, and that they had a commitment that we expected them to adhere to. That we were not unsympathetic with the needs that they had, and they needed to understand and be able to explain to us why what they had proposed was not working out like they had proposed it. But even with that, it didn't change the fact that that was an obligation on their part. But we did agree at that point to meet again on November the 8th.
Next week. Mhm.
Who'd you say, who's the meeting? Who met?
Dr. LeGrand and Kevin, plus the Chairman Singletary and myself, and the vice chair for the school board, I think is Dr. Banks.
Mhm.
And Betty Golston was as our vice chair, but she asked Carol McCall to attend instead of her.
Yeah, I mean, they were very clear in that meeting and seemed, I don't want to overstate it, seemed a little surprised or confused that they had this payment that had to be made every year. And basically, Dr. LeGrand said in that meeting, if I'm wrong, correct me, please, that she did not see how the school system could sustain making that payment every year going forward. And we
And I
just
agree.
kind of looked at her, and that was, yeah.
And we also looked back at her proposal to us, and it seems like the last proposal that was made, it included
It was from Hargrove.
It was from Hargrove, so it was his last year's budget. It had that payment in there.
Right, I mean, yeah.
What happened to it then? Well,
We don't know.
We don't know. And,
It's a-
and that's,
it's a lot of
and
money.
at some point, that may be a discussion that this board needs to have,
Mhm.
as far as what they're ultimately may come back and ask us. I know what my response is.
Yeah.
But I don't
Lord have
I don't
mercy.
speak for this board, not without authorization.
Well, correct me if I'm wrong. We give them the money to turn around and give back to us to make that payment. I don't
What happened
see
to
the
the money, though?
complication in that, but
They'll figure out how to take it out of the 10 million.
I hope so. Okay, am I next?
Done.
No, I'm not
Oh,
done. I'm-
Betty.
Yeah, she's next.
Oh, you're not finished yet. I'm sorry, Kelvin.
No, that was it.
No, Kevin is through.
So you ready for me? Okay, everybody got this in the package, and all you need to do if you care to do it, hopefully everybody will do it, is to recommend this unique individual that has done extraordinary things during the COVID 2020 and 2021, and give your recommendation to Jason, and we need to set a time when we want it to be given to Jason. Your recommendation.
Okay.
Will
The
every,
very best one person. Yes,
go ahead.
that's all.
So each commissioner gets one person?
One person.
And what does this recognition look like? They just come to the meeting and be recognized? Is there a certificate?
Yeah, we do the press with them, take the, have the press, everything, take the picture, give them a plaque. And that's why we need to get it in, maybe say by December, maybe 15th or something like that. And so Jason have time to get the plaques ordered, and maybe we can have the award program, have a part of our regular February meeting, because we don't want to do anything the January meeting because it's always too busy. And Jason talked about possibly February, but whatever you want to do.
So there'll be 7 individuals.
7 individuals, yeah.
And I haven't read it. Is it an individual or is it an organization?
It's got to, at this point, I hope that we can deal with just the individuals, because with the time element and everything, we deal with big groups and you could add all of these people. It'd be easy if we could come up with one person that maybe was part of that group that was extraordinarily good or did some wonderful things for somebody or some group or some nursing home or whatever during the COVID time.
If I recommend somebody and I give that to Jason and you recommend the same person,
Well, we got to work it out. Then.
then Jason needs to let one of us know.
No,
So,
right.
so one of us goes find a different person.
Yes, yes.
And it has to be
Yes,
somebody in the county.
Has to please let it be somebody in Scotland County, if
Yeah.
it's possible, to let it be somebody in Scotland County. But isn't it nice to be able to say thank you to somebody that did something wonderful to help somebody during this COVID?
You gotta
So
get yours
that's
in
just an
early.
idea. And if you think December 15th, you can get this information to us, to Jason. You think that's long enough for you to decide?
December 15th?
By when? Okay, can you do it by the next meeting in December?
Oh, yeah.
Okay,
I can have it done by next week.
okay. Or do you think February meeting maybe or March would be ideal time? I don't wait too long because the pandemic may be gone about and people forgotten it.
It may be gone. It ain't gonna be forgotten.
Say
Probably
it's
not even
definitely not
gone.
gonna be forgotten.
Yeah,
I don't know why January wouldn't be okay. I mean,
Well, the thing about it's the first year, the first
I know, but
meeting of the
we,
year. Is anything going? Well,
the only
Jason
thing
could
I
order-
remember on the first January being different is the water board, but we do that before the regular
But
meeting.
Jason could order all these flags.
Yeah, but that don't take that long, would it?
See, I have a copy of it.
Yeah,
Right.
just me a package.
You have it.
That's
Yeah.
details. Yeah. Right.
Just two.
Do we tell this person we're nominating?
No, please, not yet. Let's let it be kind of, because people will get mad maybe. You should have nominated me. I can see the beach, Reverend Gibson, Commissioner Gibson having that situation with his church. But, yeah, let's
So
keep it
You want us to have these recommendations to Jason by the next board meeting?
next board. And,
In the hot seat.
yeah, you're gonna be in the hot seat.
May want to defer your responsibility.
Y'all tell me who to.
And it, that's it. Commissioners' comments?
I yield.
Oh, yeah, Partners in Ministry is having, Jason can tell you, having their not groundbreaking, it's groundbreaking.
Yeah, it's groundbreaking.
Oh, I thought it had to be groundbreaking. Okay, November 16th, if you want to go by there.
Yeah, I believe Commissioner Gibson and Commissioner Fatter have passed.
I passed.
10 o'clock.
Another thing.
Crawford?
Well, I'm going for the county, so whatever. Just want you to know.
No, we're not passing on that. We're passing on talking, discussing.
Oh, okay.
She thought we were talking about
I thought you
passing on
talking
going
about
to the.
passing on. Okay,
Well, we got
thank you
the
for
committee
clearing
meeting.
that up.
We can make it
Thank
as fast as
you.
possible, and hopefully everybody will try to make it 9 o'clock
Friday.
Friday at Laurel Hill. Do we adjourn? Or do we-
I must
We
be
adjourn.
tired.
We adjourn.
I'll be in Manhattan, New York on Friday, so.
It's not fair that John going to New York and we still
Show
in
it
Scotland.
off.
Aaron, Fatter, make a
Show
motion to adjourn.
Second.
Second, all in favor, say aye.
Aye.
We're adjourned. Thank you.
Time is
Well, we made it before 10 o'clock, people.
about 2 minutes.
Do you have one of those
Oh, you
forms?
scared me.
Oh, I'm sorry.
Yeah, Jason can, I'll give it to you. It's in your package. It's in the package. But you didn't get the package.
I get it online.
Oh, yeah, Jason will give it to you. It's 2 pages.
All right.
Jason, would you make some, extra copies of that?